All right, we're back for the second half of chapter 19. This focus on primarily just some common injuries, common um, conditions that could affect the eye. First up, conjunctivitis, aka pink eye. This can be bacterial or viral. Either way, causes severe itchiness or that chemosis of the eye. Eye appears puffy, appears pink, irritated, red. They might have some oozing or some discharge. If it's clear, it's a viral conjunctivitis. If it's yellow, if it's green, if it's crusty, it's bacterial. Bacterial typically needs eye drops, okay, so a specific antibacterial eye drop. Viral, most often the optometrist will just let it run its course. The big thing is conjunctivitis or pink eye is incredibly contagious. All right, it's spread through touch. So no activity, no participation, no contact sports, even swimming has been shown that you can spread conjunctivitis through swimming. Also, instruct your patients, stop wearing their contact lenses. Okay, I've had patients in the past where you send them to the optometrist, get looked at for conjunctivitis. It doesn't get better for a couple days and find out they continue to wear their contact lenses. So make sure they take those out. Here you can see conjunctivitis, red itchiness, the eye just looks irritated. Okay, they might have some crusties or that discharge. Again, fairly simple, resolves in a couple days, especially if it's bacterial with the use of eye drops. Periorbital hematoma, aka a black eye or a shiner. Okay, getting hit, taking a direct blow, causes swelling, causes bruising, causes discoloration. Big thing to keep in mind, if the eye is so swollen, all right, so if you can't open the eyelid, it's a good idea to refer. The other thing is, as you palpate those bones, that frontal, that orbital margin, that maxillary bone, as you palpate around that orbital margin, if things are soft or squishy or crunchy, refer, okay, because it can hide fractures. So again, just discoloration, just bruising around the eye. Now, luckily, periorbital hematoma is very, very common. All right, the eye, set of strong bones fused together, good protective device. However, fractures can happen. One of the main red flags to look for with an orbital fracture, a droopiness. Okay, so look for a droopiness in the eye or potentially the inability to look up. So here we can see why we get that droopiness. You're hit by an object, that orbital floor blows out, and that eye sinks. Okay, so whether it will sink or have an inability to look up, that can indicate an orbital fracture. With orbital fractures, you might also have some air escaping around that eye socket. I've never seen this. I don't want to see this, but because there's a fracture and there's a break, and now you have the passages behind, the nasal passages behind the nose, those are now in the orbital socket, and so you could, for example, when they blow their nose, air comes out of that socket. Kind of creepy. Paresthesia, they'll have numbness and tingling in their cheek. They might also have some crepiness, that crunching. With a suspected orbital fracture, refer, okay, definitely refer. If they don't have pain, and I have had a couple orbital fractures, I haven't, although seen the air escaping, I have had a couple orbital fractures that didn't cause a great deal of pain. I referred, throw an ice pack on them, try and minimize that swelling, send them to the clinic, get an x-ray, make sure it's nothing significant, then we're not going to damage the eye. You can also shield the eye, so whether an eye patch, but you just want to tell them look straight ahead. Corneal abrasion, or a scratched cornea. Mechanism of injury, getting a piece of dust, dirt, metal filing, something in their eye that scratches the cornea. You can see their signs and symptoms. Typically 24 hours, the cornea has a good blood flow. That conjunctiva kind of helps wash everything out. Most optometrists, though, will also prescribe antibiotics to help make sure there's no infection. This is why we always wear protective lenses, protective devices. Here you can see this person had a metal filing that came across and scratched their cornea. This is the dye test that was talked about earlier on that last slide. So this had metal filing across, and this person actually had a piece of dust caught between their contact lens as they wore it, and then it just scratched the entire length of that cornea. Sometimes you can have a laceration, whereas a corneal abrasion will just have blurriness. With a corneal laceration, they'll have pain and the inability to see. There we can see chunks. There with light, you can see that tear in the cornea. This also has a great deal of swelling and fluid within that cornea itself. So those are two very significant corneal tears. Hyphema. This is bleeding in the eye, all right, caused by blunt trauma most often. However, it can be spontaneous with like a sneeze, can cause a disruption in the blood flow, but now you have blood in that anterior chamber. I go of the position, refer to the ER. Okay, get them referred, get them checked out. Typically resolves in 5 to 6 days. It kind of looks creepy. It kind of looks scary at first. But as long as there's no any objects in there, it will usually resolve on its own. But again, because it can have permanent effects, I always recommend just get it checked out. Retinal detachment. Oftentimes, with quick, violent motions of the head or a jar to the head, you can have the retina detaches, so that posterior aspect of the eye pops out. Our big red flag, sensation of a curtain. Okay, so the curtain moves across or the curtain comes down. They might also have a blind spot or flashes of light. With a retinal detachment, refer immediately. Here's what it looks like. But what the person would complain of is there's a sense of a curtain, and their vision slowly decreases as that curtain comes down. Again, because that retina is not receiving the signals properly. Ruptured globe. This is far and away our most catastrophic eye injury. This is where, as we think about the eye or the eyeball, it pops. We see this primarily when there's a sharp object that strikes the eye, or a small object that, rather than hitting the eye, the orbital margin, and hitting the bones first, it directly strikes the eye and causes the eye to essentially pop or burst. You can read through the signs and symptoms. For this, immediate transport. I would hope that if you ever have a patient that presents with this, that shows kind of these demon eyes, please refer. Here's some imaging. We can see a total loss of that globe. Unfortunately, with these injuries, you don't heal from. This causes a permanent loss of the eye and a permanent loss of vision. So in rare cases, we can kind of put things back together, but most of the time you really just refer and hope for the best. On-field management. All right, one of the most common things you complain of is just getting dirt, dust, chunks in your eye. Oftentimes that conjunctiva or the tear duct will wash it out. If not, it's always a good idea to have saline. Saline's your first choice. If you don't have saline, water works as well. You can use a Q-tip to kind of blot, or a piece of gauze to blot. The big thing is you don't want to swipe across. You just kind of want to go down and then straight up to try and get that foreign object, whatever it is. Do not rub. I know it's the common reaction, but if you've got a patient, do not rub their eye. Tell them don't rub their eye, because that will just make it worse. That puts them more at risk for a corneal abrasion or corneal laceration. If there's a chemical burn, so they get something in their eye, cleaning agent, whatever it may be, flush thoroughly with saline or water, typically 10 minutes. And then if you do send them to the ER or the clinic, take a picture or send them with a sample of that solution. If they're wearing contact lenses, you can put on gloves, try and remove the contact. Again, I always try and have them remove their contact, but if not, I've taken out a few contacts, and the big thing is just wear gloves and pull laterally and down at the same time. If you can see an object that is sticking in their eye, for example, a metal shaving or a metal filing, don't remove it. Okay, put a plastic cup, put a cover, cover both eyes, tell them to minimize eye movement and get them seen as soon as possible. Here's a great list of immediate referral objects or immediate referral items. Again, my rule of thumb, if it's an injury to the eye and it's not conjunctiva, I'm going to refer them on because the eye's vision is such an important sense. I want them to have the best care and the best treatment, and I just don't mess around with it. So almost all eye conditions, I'm going to refer. Here we can see this person was a construction worker, fell 3 stories on a chunk of rebar, probably had a pretty significant eye injury. And this person was actually in a car accident at University of Iowa, or they were seen at the University of Iowa a couple years ago, and had a ruptured globe. So in addition, they were fortunate enough they were able to save this person's eye. But again, pretty traumatic injuries with the eye. We'll start next, chapter 20, face and related structures. Again, talk about the ear, talk about the nose, eyebrows, and we'll keep moving from there. Thanks.